Hi, everyone. So today we will be talking about healthcare reform. My name is Marlene Mejia Quinteros, and I'll be presenting today. So first of all, we're going to start about talking about healthcare in the United States, finances, universal coverage, how to improve quality and population health status, how to reduce healthcare costs in the United States, how community involvement on decisions makes an impact, and a conclusion of everything that I'm going to be going over. Sorry, I'm a little sick, so don't mind it. So, first, we will be talking about the healthcare in the United States. So, the healthcare in the United States is shaped on it's basically spends a lot of money on healthcare and has a high cost for individuals, which results in worse outcomes. And one way that we can fix the healthcare system is by keeping the high spending on the healthcare because it's important for many people, but providing accessible healthcare costs for everybody. So, the US healthcare system spends millions yearly to help individuals get the best medical attention and services. Still, it is not the best because there's various outcomes such as low life expectancy, high suicide rates, high chronic disease burden, and high rates of obesity. People are not using healthcare services because of the high costs that come along with it. So, if the US spends the most on healthcare, it's really important, like it's really essential to make sure that there are affordable costs for individuals to get medical assistance and help improve their overall health. There is no point in spending so much money on healthcare if there are still so many health issues that affect people, making their health status be at risk. So, this is why it's vital to fix the healthcare system because we need to make use of the healthcare system and services that each individual needs based on their health issue. So, talking about the organization of finances in the United States, there needs to be a plan. It's crucial to spend efficiently to get the best results regarding the health outcomes of individuals. So, the government must make an outline of spendings, including every age population, to make sure that every age population is getting the accurate help. The government must stop unnecessary spending on programs that do not cover individual and spend equally on a variety of programs that include everyone and not just a specific population. Also, it's important to develop programs using funds for the uninsured, as we know that many are uninsured due to the high cost. So I believe it's vital to implement steps on controlling the finances because if we want if we control the finances to develop a well spent healthcare system in each category, we can address all the different issues in each different county in the United States. So we should use the funding to target specific critical health issues that can be life threatening. Um, Spending on the healthcare services and products in the United States is about 1.3 trillion as of 2000. So it's probably more this year since every year it increases. If the government is spending so much money, they should ensure that the widespread diseases, infections, and more that affect the people's health is being addressed. It's essential to spend wisely on healthcare, making sure that everyone is getting the necessary health assistance at a reasonable cost. So, when we talk about universal coverage, how can the government help? The government funds all these types of programs, and it's really important to understand why universal coverage can be helpful for everyone in the United States. So the government provides programs that benefit everyone like Medicare, Medicaid, Medicare care for the elders, Medicaid for the poor, low income people. So I think it's important to kind of touch base on and like develop programs for the uninsured as well, because a lot of uninsured or a lot of people that don't have insurance or can't afford it are not getting the proper care. And you know, this universal coverage can improve the health status of every individual in the United States, because we can address significant health issues that keep failing to improve. Like, not everyone qualifies to get medical assistance in the United States under Medicare, Medicaid, medical. So the government should fund more programs that cover everyone and not just a specific portion of people. So, sorry. Expanding coverage for everyone can help include various options for people in both private and public areas. Universal coverage will benefit every American because it will provide medical assistance and insurance for everyone. Therefore, everyone needs to understand that universal coverage will not leave anyone out when it comes to having insurance and receiving medical assistance. The healthcare system leaves many uninsured aside, unable to have any medical help due to high costs or other specific reasons. Universal coverage will solve many of the uninsured people in the United States. Okay, so how can we improve quality and population health? So I was doing research and I came across 4 things that I believe and I stand with that can help improve the quality and population health. One of them is building community networks. So it's essential to focus on the main factors that can help improve or maintain everyone's health in the United States. So it's important to see what works. So community networks, if we build community networks, it can significantly impact positively to people's overall health, because the leaders can serve as role models, helping the community adopt healthier lifestyles, encouraging one another, and helping each other know about resources that they might not know about. So often people must see things to believe or to understand. So if the people in the community say that one thing has helped their health, or this is what they can do to help their health, that can be a significant influence to help the other person that doesn't know about anything about that can improve their health, and that person can adapt to that change and support their overall health and pass it on to their family or future generations. So reducing healthcare costs, number 2. If we reduce healthcare costs, more people will seek to get medical assistance because they know that it will not create more stress, since it's going to be affordable. So if we increase the healthcare quality, if the government spends so much on healthcare, everyone should receive quality healthcare at an affordable price. I know many can agree with me, because if so much money is being funded to the healthcare in the United States, why isn't it the best, or why isn't it covering many individuals? So quality healthcare can bring many pros that can prevent diseases or health risks from progressing. So also we can reduce barriers between local health care systems, public health departments, and communities. The reduction of barriers between departments can help address the main determinants of health, which can help in the long run. So how to reduce healthcare costs in the United States. As we know, healthcare costs in the United States for many people is very expensive. So there are many ways to reduce healthcare costs in the United States by merely prioritizing factors that benefit the patient, because they're the ones that receive the care. So if we give patients and consumers more information and power, it will help them understand that there are different costs and various types of valuable information that they can use and provide the patient or consumer the opportunity to make smarter choices and save money when it comes to their health. If we decrease the number of medical tests used by physicians when they're assessing the patient, and not using a test for every medical visit we can easily reduce a significant amount of cost there. So tests would only should only be offered to patients if necessary in medical facilities. If there is a competition among healthcare providers, there could be more potential competition in the market. So it results in less high costs. So research by Lawrence and Scan Foundation have illustrated that more competition leads to a better quality of care. So as we know here in the United States, many prescribed medications can be costly. So if there's some sort of negotiation on prices with cheaper brands, or um, I don't know, cheaper medications that can be offered at a lower cost, there could be a huge, massive decrease in prices, resulting in fewer healthcare costs for individuals. So we can see that there are many factors that can help reduce healthcare costs in the United States, but it's just a matter of fact of putting these things into place, and we should definitely consider this. We should definitely. So, as I came across my research, I realized that communities should be involved in decisions, especially if, like for like example, like when it comes to voting, it's like it really makes a big difference if everyone votes. I believe that keeping the community involved on decisions can make a huge impact, because we can help address many issues from their points of views, and every person deserves to be involved in decisions that could potentially affect their health, and they should have the right to have their voice count in decisions that concern them, you know. If we incorporate the voices of communities, we can dig deeper and help address issues that these communities face on a daily basis, and supply them directly with the necessities that could improve their health statuses. Excuse me. So like food, medicine, utilities, housing, and more resources that people are not aware of sometimes. It is crucial to understand that what is needed in the communities to fund and provide based on what is needed. So then everything is given carefully, and not like just given and then it's a waste of money. The people living in these communities can significantly impact decisions if professionals carefully inform them about healthcare to improve their community health issues, depending on what they think needs the most attention. So when it comes to coming across communities, um, we can understand communities. We can put them in, like we can put ourselves in their shoes, so we can see how how they're struggling, what's going on, what are the risk factors that can be addressed. It's just you have to listen to your community. It's important to listen. It's important to implement strategies that can help your community. It's important to just keep your community healthy, and make sure that you keep them informed, educate them, so that they can be involved in decisions that affect their health. So, as we conclude, we know that reducing healthcare costs for individual is a big one. Providing coverage to every individual in the United States is crucial. Finances should be organized, making sure that funds are equally distributed, using them appropriately. It's essential to make changes in the healthcare system by reducing healthcare costs for every individual, providing coverage to every person in the United States, and just simply having an organization with the finances to make sure that the funds um, are being provided for people that mostly need them, and programs are being offered, and equally among people, and not just the older people, the younger people. And you need to make sure that everyone is covered and everyone is getting the actual help from in the United States. And these are just a couple references that I used in my research as I did my PowerPoint. And that's pretty much it. Thank you so much for watching. Have a good one.